Hi, my name is Jessica Hunter, and this is Module 1 for Adult Health 2. In this video, we are going to be describing the process of breathing and asthma. The process of breathing is divided into two phases, inspiration and expiration. During inspiration, the diaphragm contracts and pulls down, while the muscles between the ribs contract and pull upward. This increases the size of the thoracic cavity and decreases the pressure inside. As a result, air rushes in and fills up the lungs. This can be seen in this diagram right here. As this represents the diaphragm, it's pulling down and contracting the lungs and filling them. During expiration, the diaphragm is relaxed and the volume of the thoracic cavity decreases while the pressure within it is increasing. As a result, the lungs contract and air is forced out. For this project, we had to watch an engineering video that described a model of the lungs, and here is the model of the lungs. Why do some people have a larger or smaller lung capacity than others? This could be due to a disease process. For example, some people who are diagnosed with COPD or asthma, to diagnose someone's lung capacity, they'll use a spirometer test, which provides the measurements of the lung capacity. Examples of measurement would be forced vital capacity. This is the maximum amount of air you can forcibly exhale from your lungs after fully inhaling. It's about 80% total capacity because some air remains in your lungs after you exhale. Forced vital capacity can decrease about 0.2 liters per decade, even for healthy people who have never smoked. The next measurement is forced expiratory volume, which is known as FEV1, the amount of air that you can exhale with force in 1 second. FEV1 declines 1 to 2% per year after about the age of 25, which may not sound like very much, but it does add up over time. Describe how asthma affects the lungs. The airways will become swollen and inflamed. The muscles around the airways contract, and the airways produce extra mucus, causing the bronchial tubes to narrow. Describe the priority medical and nursing management for a patient with asthma. With patients with asthma, a nurse will give them a short-acting beta, Anginitas. Albuterol is a medication that is quick-acting rescue inhaler. This may be needed. The patient may need to use a machine called a nebulizer, which turns the medication into a mist so it can be inhaled deep into the lungs. Another medication that could be given are oral corticosteroids. These are taken in pill form and help reduce inflammation in the lungs. They can also help get asthma symptoms under control. These can be given intravenous in typically patients who are vomiting and who are experiencing respiratory failure. Atrovent HFA is sometimes used as a bronchodilator to treat severe asthma attacks, especially if albuterol can't fully do anything or does not affect it. If an asthma attack becomes life-threatening, then intubation and mechanical ventilation and oxygen will be ordered. This is when a doctor will put a breathing tube down the throat into the upper airways. A machine is used to pump oxygen into the air and will help a person breathe while the doctor is giving medication to control the asthma. In community health, we were taught that if a child comes into the nurse's office with an asthma attack, that if you give them a Coca-Cola, the carbonation in caffeine can help stop or alleviate the symptoms of an asthma attack until 911 or medical personnel have come to the school. What would be important to teach the patient with asthma? So it's important to advise the patient on the factors that can cause an asthmatic attack, such as the foods they eat, pollen, animal, dust, and the weather. The patient should be instructed on how to use the correct oral inhaler, home oxygen, and incentive spirometer. The patient should avoid a person with an infection. The patient should also be instructed about the factors that increase asthma, such as respiratory infection, cold air, emotional stress, and environmental pollution. Even exercise can cause this. What community resources are available to clients with asthma? There are health centers in the community that a person can go for educational purposes. There are clinics. The library also offers pamphlets, at least in my neighborhood, about asthma. And there's always online resources such as Mayo Clinic and other resources that people can access to help with their asthma. Thank you for watching my presentation.